Ladies and gentlemen of the media and the Bahamas, good afternoon. Thank you for joining us again today for our COVID-19 update. We will begin as usual with the Minister of Health providing an update. Minister.
Good afternoon, members of the press, and good afternoon, Bahamas. Here is the latest update on the COVID-19 pandemic in the Bahamas as of Thursday, the 5th of November, 2020. 34 new cases were confirmed yesterday. This brings the total number of confirmed COVID-19 cases in the Bahamas to 6,916. Total COVID-19. Total COVID-19 hospitalizations have been significantly reduced and currently stand at 59, which is down from the high of 122 on the 22nd of October, 2020. There are 12 COVID-19 patients hospitalized in the Grand Bahama healthcare system. 8 are moderately ill and 4 are in the intensive care unit, or ICU. In New Providence, there are 13 COVID-19 patients hospitalized at Doctors Hospital. 10 are moderately ill and 3 are in ICU. There are 5 moderately ill COVID-19 patients hospitalized at the South Beach Acute Care and Referral Center. At the Princess Margaret Hospital, there are 27 COVID-19 patients who are moderately ill. There are no patients in ICU at PMH at this time. Currently, the Sandilands Rehabilitation Center is caring for 2 cases exhibiting symptoms of COVID-19. In all, there are 1,835 active cases of COVID-19 in country. 97 persons recovered from COVID-19 yesterday. This brings the total number of recoveries to 4,876. The recovery rate is now at 70.5%. Unfortunately, there was 1 COVID-19 related death reported yesterday. The total number of confirmed COVID-19 deaths now stand at 150. In total, there have been 29 deaths not related to COVID-19 and 25 deaths remaining under investigation. A total of 331 tests were carried out yesterday. Of that number, 34 were positive results, 279 were negative results, and 18 were identified as repeated tests to assess recovery. Ladies and gentlemen, a total of 37,423 tests have been carried out as of the 5th of November, 2020. On the 22nd of October, 2020, there were some 122 COVID-19 patients hospitalized. As of yesterday, again, the number of COVID-19 hospitalizations was down by more than 1/2 at 59. This respite has given our healthcare workers a chance to regroup and prepare to deliver additional care going forward. Health professionals continue to maintain the current bed capacity in order to accommodate any future increase in COVID-19 hospitalizations. Currently, the COVID-19 bed assessment at Princess Margaret Hospital is at 78. 30 beds at the special pathogen unit, 11 beds on the private medical ward, 14 beds on the medical surgical ward 2, and 8 beds in the legacy unit, and 15 beds in the old GPC area. With the addition of the 28-bed COVID-19 isolation and treatment unit operated by Samaritan's Purse, the total COVID-19 bed capacity at PMH is at 106. As of yesterday, the 5th of November, 2020, the COVID-19 isolation and treatment unit of Samaritan's Purse at PMH was caring for less than 10 patients. We are happy to report that effective today, the 6th of November 2020, PMH staff will be transitioning into the full operation of the Samaritan's Purse COVID-19 isolation and treatment unit. The clinical team members from Samaritan Purse are leaving the country this weekend, and we will be working through the finer details with a smaller closeout team next week. Samaritan's Purse has also handed over all medical equipment, the tents, personal protective equipment, and other supplies brought in to help the Bahamian people. We are most grateful to Samaritan's Purse for their Christian charity. Samaritan's Purse has trained more than 700 staff members of the Princess Margaret Hospital and are leaving behind manuals and presentations to help strengthen infection prevention and control techniques in the Bahamas. Ladies and gentlemen, controlling the transmission of COVID-19 requires a combination of strategies. One part of that strategy is testing. The Ministry of Health's testing protocol is expanding. Although the RT-PCR test remains the gold standard in country to diagnose COVID-19, selected rapid antigen tests are now being incorporated into our protocol to detect an acute infection of COVID-19 in patients who are experiencing symptoms. Despite being less sensitive than the RT-PCR test, rapid antigen testing is relatively inexpensive and provides rapid results. This type of testing has the potential to provide wider access to COVID-19 testing at an acceptable turnaround time when there is limited access to RT-PCR testing. Currently, there are 2 antigen tests that have been granted World Health Organization emergency use authorization: the ST Biosensor and the Abbott Pan Bio Rapid Antigen Test. Both of these tests have been independently validated and found to have high sensitivity and specificity in symptomatic persons. The only drawback is that there are currently no published studies of rapid antigen test performance in asymptomatic populations. The Ministry of Health wishes to advise that any antigen test used in the Bahamas must meet 4 criteria as outlined in the national protocol. The test should be administered by the trained healthcare providers, undergo local validation before use, be performed with continuous quality assurance and applicability biosafety precautions, and be performed by a facility that has been certified by the Healthcare Facilities Board. To make a COVID-19 test available to a wider cross-section of Bahamians, we continue to explore other testing strategies. The saliva test for COVID-19 is an alternative to the current nasal swabbing protocol. The saliva test is an easy alternative to test symptomatic and asymptomatic persons by RT-PCR. This test is a streamlined version of the RT-PCR test. This is because it is cheaper than the currently used swab-based RT-PCR test. It does not involve swabbing the nose or throat of people, or it does not require viral extraction in the lab. The saliva samples are easily obtained and stored at refrigerator temperatures for 1 week. A swab can only be preserved for 3 days. This method offers benefits to the family islands for easy storage and transport. Recently, the National COVID-19 Ethics Committee approved the saliva direct test to undergo an evaluation by being piloted within New Providence and selected family islands. The study will be targeting asymptomatic persons. In this pilot evaluation exercise, consenting participants will be swabbed as normal, and a saliva sample will be obtained at the same time. This way, we can compare the results and measure the accuracy of the saliva-based method against the swabbed method. This pilot is anticipated to proceed during November. The National Reference Laboratory will present its findings and recommendations as it relates to the performance of and potential future use of the saliva direct test. We hope to be able to utilize the saliva test to enhance access to testing in the community, as well as introduce greater cost efficiencies into the national testing policy in the Bahamas. Ladies and gentlemen, the new term twindemic is being used in the medical community and is attracting a lot of attention. Twindemic refers to the twofold threat of a flu outbreak coupled with the present COVID-19 pandemic. There is a potential for two very serious diseases to affect many people here in the Bahamas and around the world. The overlap of these two diseases, the flu and COVID-19, can devastate individuals, families, and even the healthcare system. These two diseases have some of the same symptoms. This means that individuals have to be properly assessed and tested to identify which disease they may have. The twindemic can lead to an increase in doctor's visits and laboratory testing. With both diseases attacking the Bahamian population at the same time, this has the potential to overwhelm our healthcare services. A co-infection of the flu and COVID-19, or having two viral infections at the same time, increases the risk of serious complications, even death. So what can we do? You can be prepared with flu medication, or you can get a flu vaccine. We must be diligent as we continue to follow the recommendations outlined by the Ministry of Health to reduce your risks of being infected with COVID-19 or influenza. The risk reduction strategies include staying home if you are sick, avoiding large gatherings, frequently washing or sanitizing your hands, wearing a face mask while out in public, covering your nose and mouth with the inside of your elbow or tissue when you cough or sneeze, and cleaning and disinfecting frequently touched surfaces. My fellow Bahamians and residents, ID Week is a program geared toward healthcare professionals in the infectious disease. During the start of the program in October, several new findings and salient points about COVID-19 were revealed that are important for Bahamians to know. The Center for Disease Control and Prevention in the United States has revised its definition of close contact. A close contact is a person who is within 6 feet of an infected person or infected people for a cumulative total of 15 minutes. This means that COVID-19 may be transmitted from an infected person or people to a close contact by having multiple short exposures, not merely one 15-minute exposure. More than ever, there is a need to follow the COVID-19 preventative measures. New information also reveals that where possible, COVID-19 preventative measures should be applied in combination with other preventative measures. For example, to help prevent COVID-19, we are encouraged to wear a mask. However, with the new information in mind, we are being encouraged even more to wear a mask. To give additional protection, one may wear a mask in tandem with a shield. If we avoid contact with all persons or being within 6 feet, then avoiding closed spaces and crowds adds another level of protection. It is important to remember that staying outside instead of inside can prevent exposure to COVID-19. Lastly, it is important to discuss some emerging concerns from the workplace. Employees have advised that some employers have asked them for proof that they can return to work if they were infected with COVID-19. And some have gone a step further and requested employees to provide their medical records for their supervisor's review. It is important to note that a person does not have the legal right to request the medical records of a patient without their written consent. Similarly, an employer does not have the right to demand to see the results of an employee's COVID-19 test without the employee's express written consent. However, the employer can request a letter from the Ministry of Health that verifies that the employee has been cleared to return to work. It is recommended that once the Ministry of Health has cleared a person from quarantine or isolation, no further testing is required for them to attend work. In such cases, an employee is issued a letter advising of their suitability to return to work. Such a letter will have a coat of arms, a file reference number, a valid signature from the physician in the National Surveillance Unit as the designee of the Chief Medical Officer. Ladies and gentlemen, while utilizing curbside methods, businesses are reminded to clean their surroundings at least twice daily and clean high-touch surfaces continually. Practice social distancing, and if a person at the business place has the infection, that individual should be isolated for 14 days. As we approach the holiday festive season, please remain disciplined. Stay safe and take care of your health and the health of your family. And may God bless you, and may God continually bless this great Commonwealth of the Bahamas.
Good afternoon again, Bahamas. I will now provide additional updates, looking at trends and other indicators that we use to characterize, that is essential for characterizing the epidemic as well as guiding decision making. First slide. When we look at the days since last confirmed cases by island, we see Cat Island and Maikal constituency continue to experience extended periods with no new COVID cases. Most other islands are reporting new cases on a daily basis. For a look at the other islands, we see New Providence. Here are some quick stats for New Providence. Grand Bahama, Eleuthera, Abaco, Andros, Exuma, and Bimini. These quick stats reveal important observations. There is reason for concern in Grand Bahama. Cases are climbing in Eleuthera, and I will expand on Eleuthera in the upcoming slides. And as we looked at Abaco, we noticed that it's plateauing. On Saturday past, the 30th of October, a health team of 13 from New Providence commenced a 4-day surveillance mission to Eleuthera. This was to support the local health team in assessing and containing the spread of COVID-19 on that island. I pause here to say a special thank you to that team who, on very, very short notice, took the opportunity to actually go down and do what was required for us to better understand the situation on that island. The team was divided into 3 groups, each assigned to one of the 3 districts of Eleuthera, that is North, Central, and South. Important observations from the team once they returned from the mission are as follows. Almost 80% of cases ever reported for Eleuthera were among those 50 years and younger, with the greatest proportion among 20 to 39 years. All districts on that island have cases. However, South Eleuthera had the greatest proportion, 37.8%. This was followed by North Eleuthera, which had 29.7%, and then Central, which had 24.3%. Another observation was that the local bars seemed to be popular hangout spots, and a number of cases were linked to these bars. Additionally, the current increase in cases on Eleuthera have linkages to a funeral, which had occurred 2 weeks ago. The funeral was also attended by persons who traveled from Freeport. Another observation was that minimal to no adherence to the public health measures were observed, though residents reported awareness of the measures. In many instances, it was observed that housing arrangements challenged appropriate isolation and quarantine. However, 2 of the 4 identified quarantine facilities were not fit for purpose. A further observation was the main income-gathering industries had slowed down on the island. And some recommendations came forward from the team that actually participated in the mission. One included implementation of increased restrictions similar to those of New Providence. A second was a stronger presence of the COVID-19 ambassadors on Eleuthera to ensure compliance with the public health measures. And a third was to consider closure of all bars. The residents of Eleuthera also voiced the need for extended hours to accommodate additional testing. As we move on, the ministry notes that today marks 4 weeks since the increased restrictive measures have been implemented for New Providence and Abaco. And the question would be, have they worked? The data shows encouraging signs. When we look at this slide, we see the number and trends of incident or new COVID-19 cases remain a very important indicator that we must track. From a national perspective, there have been a 50% decrease in new COVID-19 cases between October 10 and November 5th, 2020. Comparing just the past 7 days, there's been an 8% decrease. Our contact tracing investigations continue to reveal new cases being linked to social gatherings, such as funeral-related activities, parties, and socialization in more casual settings. When we look at the average new cases each week, we see the national average number of new cases continues to fall. That would be this graph. When we look at hospitalization trends, 10 COVID patients from the Family Islands are currently being managed at our tertiary care institutions. 4 from Eleuthera, 2 from Abaco, 2 from Exuma, and 1 from Andros and Bimini. Hospitalizations, however, have decreased by 68% from mid-October to now. This indicator is showing a decreasing trend, as you can see on the graph. There are currently 1,853 active cases across 7 islands. Cat Island and Maikal grouping have no active cases, and our rate of recovery currently stands at 70%. When we look at deaths, 151 lives have been lost too soon to COVID-19. There has been an average of 1 COVID-19 death each day since the beginning of the COVID-19 epidemic in the Bahamas. No matter how hard the healthcare professionals try, the high prevalence of comorbidities in the Bahamas continue to influence the disease course and the outcomes of the COVID-19 patients. During the same period, 83% of all COVID-19 deaths have been recorded in New Providence. That would be during the period from the beginning of the epidemic. Berry Island and Long Island have each recorded 1 COVID-19 death. When we look at the deaths, more men are dying from COVID-19 than women. 55% compared to 45%. Although those 50 years and older still account for the greatest proportion of deaths, more younger people have died in the second wave compared to the first. Another critical metric that the Ministry of Health continues to monitor is this infectivity rate, or the R0. In the epidemiology and public health spheres, it is accepted that an R0 less than 1 is desired. Prior to the increased restrictive measures that we recently started, the R0 was 1.34. The R0 take into account consideration of multiple data points over the past 14 days. The R0 value as of the 24th of October was 0.5, which is below 1, and it's suggestive of decreasing transmission. When we look at the positivity rate, which is a further measure being monitored, we see most recent data put our national positivity rate at 14%, which is 44.8% reduction from Epi Week 42, which was just before the restrictive measures were tightened. The public's question around widespread testing has come to the ministry's attention. Many countries continue to be challenged to meet the demand for testing, as it is influenced by national capacities, inclusive but not limited to the financial and laboratory capacities, as well as access to needed chemical reagents on the global market, which many countries are still struggling to secure. The Bahamas is following recommended testing strategies based on the COVID-19 transmission classification by WHO. All suspected cases are being tested for COVID-19, as are symptomatic contacts, according to our WHO case definition. It is critical that testing of suspected cases continues so that cases can be isolated, contacts can be quarantined, and chains of transmission can be broken. When we look at our lab performance, in the last update to you, we reported that the surveillance unit is actively monitoring the length of time a lab takes to report real-time PCR results, both positive and negative. On average, 67% of COVID-19 samples are reported within 48 hours or less. In addition to the length of time for reporting of results, the Ministry of Health, through the National Reference Laboratory, will continue to evolve with new research and experiences. This is true for the technologies used for COVID-19 detection. Given their improved sensitivity and specificity, select rapid antigen tests are now acceptable testing modalities in individuals presenting with COVID-19 symptoms. The Ministry of Health has now approved the use of select rapid antigen testing that have been validated in the Bahamas. This will be guided by the national protocol. At this point in the COVID-19 story, antibody testing has not been validated as an effective means for diagnosing COVID-19. As such, no lab should be conducting or offering such tests to the public in the Bahamas. I want to strongly urge persons who present for COVID-19 testing to ensure the test is an in-country validated real-time PCR or rapid antigen test. The Ministry of Health intends to, on a regular basis, make available the list of laboratories and tests which have been validated. We remind the public that individuals infected with SARS-CoV-2 may never develop symptoms. That is, they may be asymptomatic cases, or they may have very mild disease, or they may develop moderate to severe COVID-19 disease. Infected individuals may test positive for viral nucleic acid or viral proteins without symptoms. That is, they may be asymptomatic, or develop symptoms. They may test, let me read that again. Infected individuals may test positive for viral nucleic acids or viral proteins without symptoms, or before symptoms start, which is in the pre-symptomatic phase, and throughout the disease. This means movements should be restricted until test results are received. Members of the press and the public, indicators being monitored by the health team strongly suggest that the measures over the last 4 weeks have been working. They have served to decrease new cases to a more manageable level, providing some relief to our overwhelmed healthcare system and workers, as well as giving us the opportunity for rebalancing of resources. A point to note, however, is that to move away from the cycle of relaxation and tightening of restrictions into a space of living with this unseen enemy, the risk reduction strategies still stands. They relate to the measures that we continue to ask that individuals be guided by as they move around. Though simple, it will keep our economy open if we are successful. It will also prevent a resurgence in new cases and save lives. As we move into this space of living with COVID-19, the health team will continuously evaluate the following questions. Is the epidemic controlled? Is the health system able to manage in the face of a resurgence? Is the surveillance mechanism sufficiently robust to manage cases and their contacts, as well as to alert if trends start to increase? To reiterate, the flu season has started. The flu and COVID-19 are both infectious and contagious respiratory illnesses. We remind the public that some symptoms of these illnesses are very similar. We encourage all Bahamians to get the flu shot, which is available at all community clinics. Thank you for your attention, and we now open the floor for questions. Ms. Jimenita Swain.
Good afternoon, health officials. Good afternoon, Bahamas. My first question is for the minister. In his initial presentation, he spoke to a pilot program that will take place this month comparing the RT-PCR test and the saliva test. I wanted to get a little bit more information on that in terms of how many persons do you seek to target in this pilot program, if you could speak, and how long you anticipate that it will run for.
Are you? Okay. Certainly, Minister is giving a pass on that one. Dr. Indira Martin from the National Reference Lab. I'm not sure if we have her on. Yes? I will allow her, as she has oversight for that pilot. Is she?
Hello, good afternoon. Thank you. Hello?
We can hear
Hello,
you.
can you hear me?
We can hear you.
Okay, good afternoon. Good afternoon. Yeah, I just, thank you for the question. So basically just to give a little bit of background on the Saliva Direct protocol that we're piloting, it was first pioneered by Yale University School of Public Health in August of this year. And essentially what it does is it allows for asymptomatic persons to be tested by use of saliva rather than a swab sample. And in order to carry out the pilot, the specific numbers that we're looking for is at least 20 asymptomatic positive persons and at least 20 asymptomatic negative persons. We hope to go a bit more than that, but that will give us a confidence interval of within 5%. So that's what we're aiming for in the first instance.
Thank you. Do you have another question?
Thank you for that response. I do have another question. Earlier in the week, the minister also indicated that remdesivir is now being used, or it's in country to be used with 150 doses. How would that be applied to the treatment of patients, seeing that the number at this time is limited?
Thank you for that question. Certainly at the national level, we intend to ensure that there is some equity and transparency as it relates to how the procurement, well, certainly any medication procured through the government facility is utilized. We would have sought to put in place a mechanism, and I would allow Dr. Forbes, I think she's on, to speak to how that works.
Good afternoon. Thank you very much for the question, Ms. Swain. So, as you correctly said, we have a limited amount of remdesivir. This is not unusual because there is a global shortage of remdesivir. So what we know is that it can be used for patients who have low oxygen saturations or need oxygen in hospital. So across the treatment sites, that includes the Princess Margaret Hospital, South Beach Clinic, Doctors Hospital treatment site, the Nationalized treatment site, and RAND in Grand Bahama, there is a process whereby the physicians will call in and they'll speak to our infectious disease team, including the pharmacist and a representative, so that we can ensure equity and accessibility. So once that's done, it's supposed to be very short and streamlined, then the medicine can be released. Luckily for us, at this time, we have a decrease in hospital admissions. And so there are few patients who meet the indication for it right now who are needing it, but it is fair and across the board. I also can report that we have ordered an additional supply.
Matthew Moxie.
Yes, good afternoon, CMO. Given the positive signs being shown on New Providence and Abaco, what is the recommendation now from health officials to the Prime Minister based on the restrictions that are currently imposed on those islands?
Well, certainly, as we often allude to, we use the data to make recommendations along the lines of, what would be the best public health way forward. And we will be putting those recommendations forward. We've started some of that information sharing with the Office of the Prime Minister, but I believe most of us will be aware that the Prime Minister intends to speak to the nation within a few days. Sunday, Minister is reminding me that it's on Sunday, so I will not wish to move forward with preempting. Minister, would you wish to say anything along the lines?
Thank you so much, CMO. There's every indication that the Prime Minister will speak on Sunday, and at that point in time, he will update the nation on any other curfew measures or lack of curfew measures that would be instituted in country. And so we will all wait until Sunday until the Prime Minister speaks.
Second question, please.
Yes, my second question is, what is the rate of testing being done as compared to just a few weeks ago when our numbers were trending high?
We would have projected a slide. I will ask them to put it up again. Certainly, we would have had a decrease in our testing, our test numbers, and there it is. Pause a minute for you to see. I trust that answers your question. Okay. Kyle
noticed the slide just now, but there is still a major concern about the decrease in testing. I know the minister touted a drastic decrease in positive cases, but there's also a noticeable decrease in testing. Can we explain this? And is it true that PMH has been unable or had been unable to conduct any testing this past week?
I have the laboratory persons here. Dr. PMH? Certainly as they come, I think the numbers that we projected on the screen clearly shows that we have had some decrease in our testing. But as our protocol speaks to symptomatic persons, if we are having less persons show up with symptoms for testing, we anticipate that we will have a decrease in those to be tested. And certainly our protocol also speaks to testing of contacts. And if you're having less cases, then you have less contacts that are likely to become symptomatic. I have Dr. Jessica Edwards. She will now give you a little more information on the PMH situation.
Good afternoon, and thank you for your question. So the Princess Margaret Hospital continues to do our testing on our routine persons under investigation, those persons who are having signs and symptoms suggestive of COVID-19, and that continues. We have had a decrease in the number of non-PUI cases tested at the Princess Margaret Hospital this week. However, those tests have been referred to the National Reference Lab, so testing does continue for our patients at the hospital.
There was no issues with testing at PMH this past week. That's what you're all saying.
So we have had a challenge with procuring some of the reagents necessary for the maintenance of one of the instruments used for our testing. So we have 2 sets of molecular tests that are performed at the Princess Margaret Hospital. One was donated by PAHO, and that would be the Gene Expert. The other is another molecular test. So that test, we've experienced some challenges with procuring the maintenance reagents, and they are expected to come in at this time because of that challenge of procuring it, which is an international challenge. We are actually referring those specimens specifically to the National Reference Lab for testing. Thank you.
I guess it would be safe to say that there wasn't much testing done at PMH this past week then, if that were the case.
I think she would have alluded to having both methodologies at PMH. Certainly, the Gene Expert, we still continue to do testing, and definitely the National Reference Lab would have actually been in a position to assist with the testing of any samples that were not able to be tested by the machine that she suggested required the maintenance. Do you have another question?
I do have a second question. We noticed a while back there were concerns regarding the, I guess, legitimacy of the antigen test or the reliability of the antigen test, but I see now that the ministry is moving forward with this. Any idea why, or why the about face?
You consider it an about face? We consider it doing our due diligence. Certainly, I think early on, and I would allow the lab persons to elaborate more, but I recall early on, we would have moved forward with the real-time PCR testing, which was the gold standard. And we continuously say that as additional modalities come on stream, we will begin to visit the possibility of use in country. But just testing and testing for testing's sake, without having the required validation at multiple levels would not benefit us. We need to ensure that as we roll out additional modalities of testing, they are doing what we would wish for them to do. If they are diagnostic, we need them to diagnose. If they are screening, then we will ensure that we have the additional requirement for the diagnostic PCR test. I'm being reminded that we well, I think we often say it, we follow the World Health Organization recommendations, and that is what we would have done. And Minister would have alluded to the 2 tests that we are actually embarking on utilizing in country, certainly validating for use in country, and they are the SD biosensor and the Abbott Pan Bio Rapid Antigen tests. Those are the 2 that have been validated by the World Health Organization, and we will be seeking to do our in-country validation to incorporate those into our testing protocol. Rachel Knowles.
Good afternoon. My first question, I believe that today makes 5 days since tourists came in or began coming in with these new relaxed restrictions that don't require quarantine. And we know that the 5-day, well, the rapid antigen test that they're supposed to take is supposed to be on day 5. So my question is, have all the people who came in on November 1st been tested up to this point? If so, were there any positive tests? And also, where are these tests being conducted on Family Islands?
Okay, so, the requirement for testing, the real-time PCR test prior to coming in country remains. And the additional testing, we are seeking to enhance the capacities across the country to make it happen. Dr. Brennan works closely with the tourism grouping. I think he's joined us by Zoom. Is he? Maybe you can shed additional light.
Yes, ma'am. So thanks for the question. The testing for day 5 testing has been a partnership with the Ministry of Health, Ministry of Tourism, and the private sector. And so there are a number of testing sites that have been brought on board. If you go to the listing is available on the travel.gov.bs website and the bahamas.com website. This includes testing facilities in New Providence, Grand Bahama, Exuma, Eleuthera, Abaco, Bimini, the Berry Islands, Andros, Cat Island, and Long Island. So we do have testing facilities that are available for testing in all of those islands. So the expansion of those areas and those facilities will continue to be ongoing. Unfortunately, we do not have the exact numbers. As you mentioned, the day 5 testing would have only taken place started to roll out as of yesterday. So as those numbers become available, we'll be able to provide them in our next update. Thanks.
Second question, please.
Well, I just wanted to clarify something on my first one. Was everyone tested today? Or was the testing done today for those tourists who came in on November 1st?
Again, we don't have those numbers today, but as soon as we're able to get all of the updates for those numbers, as it would have only been yesterday when it started, we would be able to provide an update in our next press conference.
But if we don't know today, how can contact tracing be done or keeping track of these contacts be done the way that it should be?
Third question. Is this another question? Your second question, sorry. Ms. Knowles?
Yes, it is my second question.
Okay, go ahead, please.
If we don't know by now how many people have been tested, how can we be certain that the level of tracing of these tourists is where it should be?
Dr. Brennan?
Sure. That is not to say that the authorities and the officials don't know. What I am saying is we don't have a report for you during the course of this press conference. So we will be able to produce that report for you when we have our next press conference. But the officials in the Ministry of Tourism, along with those who are charged with enforcing to ensure that persons are do so through our COVID enforcement unit, are doing exactly that. And as they produce reports, we will also have them and be able to follow up and provide you with that information.
Thank you, Dr. Brennan. Elizabeth Bryan?
Oh, yes, good afternoon, Dr. McMillan.
Good afternoon.
Yes, Elizabeth Bryan here with the Eleuthera newspaper. My first question is, during an island-wide virtual town hall in Eleuthera on Monday, November 2nd, which was hosted by the Ministry of Health Surveillance and Assessment Team, quarantine facilities in Eleuthera were visited, with two main sites identified, one in Governor's Harbor on Kibitz Key and another in Rock Sound. The team commented in their findings that both sites were not suitable for use in their current state. And at the end of their presentation, it was recommended that both quarantine sites be, one, fully outfitted, and two, official monitors to be identified for those sites. It's now about 4 days following the assessment. Have any changes or upgrades been made at these sites? Or are there any concrete plans in place to make them ready and available for use? And when would they be ready and available?
Okay, so thank you for your question. Certainly the surveillance team would have made the observation and in collaboration with the local health team and the administrators and others on the ground, I anticipate that those activities would have started. I'm not sure if Minister is able to give us any insight as it relates to the admin side or the infrastructural. Maybe I'll give him the opportunity.
We have been made aware by the health team on the ground as to the circumstance surrounding the two quarantine sites. The ministry is actively engaged in bringing those quarantine sites up to what would be considered acceptable by the ministry, so that in the event that we do need individuals to be quarantined, they will be quarantined in those sites.
Ms. Bryan, hi.
Yes, hello, good afternoon again, and thank you very kindly for those answers, Minister and Dr. McMillan. So for the second question, also during the virtual town hall meeting in Eleuthera, the assessment team pointed out that contact tracing on the island needed to be enhanced because of limited human resources now dedicated to that activity, including the need for more contact tracers, data entry personnel, and administrative staff. It was mentioned that 3 Bahamas Air staff had been trained in contact tracing during the team's visit to Eleuthera. Are there any other steps being taken now to fill in the human resource gap for the needed contact tracing on the island?
Well, certainly I would have actually participated in that, the town hall meeting via Facebook as well. And what we have sought to do is look at a number of avenues for how we could potentially enhance the capacities on the ground. I would have heard a few persons actually make almost an offer to assist. I will have to actually follow up with the surveillance team and the contact tracing team to determine whether or not we would have actually been able to actually engage individuals who would have made the offer. Certainly those on the ground continue to carry out the contact tracing activities. I know Dr. Bartlett is on. I'm not sure if she's able to provide any further insight, or I'm not sure if Dr. Swan from the contact tracing will be able to. Dr. Bartlett, Dr. Swan?
Yes, CMO, good afternoon. I am here. Nothing else really to add to what you said, just that we are seeking to engage the Bahamas Air persons, as Ms. Barnes already spoke to, and also those local Eleutherians who may have the capacity to step forward to assist us with the contact tracing on the ground. But in the meantime, we continue to work with the local healthcare team, whether it be the whole team, the physicians, as well as the nursing team in Eleuthera to carry out the contact tracing, along with any persons who may want to step forward and volunteer. So we do have an active volunteer as we speak, helping us with this process as well. So it's ongoing, and we hope in the soonest to be able to facilitate this important task of contact tracing. But in the meantime, we advise all Eleutherians to practice the public health measures. This was including wear your face mask, social distancing, and avoid unnecessary gatherings or avoid gatherings altogether. So please continue with putting the public health measures in place as we continue to try to augment the contract tracing team on the ground. Good afternoon.
Right, in addition to that, our national contact tracing efforts are also being ramped up in New Providence. We have a sustained effort that was supported by persons that were able to be engaged during the shutdown or the restricted activities. We know that as we open up, we will need to address the contact tracing needs of the country, and we have engaged a number of individuals to this point with the training of the program that has been conjointly produced by University of Bahamas, PAHO, and the Ministry of Health. And at present, we have about 30 persons that we're waiting to interview and to engage in some sort of formal process beyond the 60 or so public servants that are presently identified to be a part of the contact tracing program. The issue is that we want to ensure that as we continue to provide a response and support a response to COVID-19, that we're able to have the necessary resources, human resources, to appropriately execute contact tracing in a manner that doesn't allow us to be behind. At last count, we're reaching about 90% of the persons that have been identified as contacts of cases, and doing a great job in walking them through the quarantine process and allowing them to be relieved or released from quarantine once their time has expired. Thank you.
Sasha Lightbourne.
Yes, good afternoon, Minister Wells. Good afternoon, CMO. Good afternoon, all health officials and Bahamians at large. Dr. McMillan, this question may be best suited for you. I would have spoken to several members of the Bahamas Association of Medical Technologists. They seem to be a little concerned about COVID testing moving forward, and I'll tell you why, and I would love your response to this. They understand that some of these new tests, the rapid antigen tests, will now be sold to several places like construction sites, hotels, marinas, and their concern is that labs and clinics are held to a very high standard and they're bound by patient confidentiality. There's also the understanding that some training may happen to people who are administering these tests. However, that training is as little as a 20-minute presentation via Zoom. There's also concern about the dumping, I guess, or for lack of a better word, of these tests. Now, we understand that some hotels may be given one bin for biohazardous waste, but for a hotel like a Bahama or Atlantis, they are very big. They may require more than one bin. So their concern is now, medical technologists should be, or health professionals should be administering these tests and not just a representative from a large company such as a hotel or a marina or a construction site. What assurance can you give the Bahamian public and that association of medical technologists that every endeavor will be put in place to ensure that these tests, while they aren't the gold standard, are still administered properly by health professionals?
Well, thank you for your question, and I will begin with the response that certainly the Ministry of Health takes the safety of the Bahamian people very seriously. We would have in place a number of councils. We have the Hospital and Healthcare Facilities Council that actually monitor what happens as it relates to laboratories, and there is a standard that is set there. We have the Health Professions Council that the grouping that you would have spoken about actually would come under. And we have, as this has evolved, we have been working closely with our National Reference Lab as well as our other key laboratory persons within the national COVID arena. And one of the key things that we continue to look for would be how we will actually, what is the system that we will put in place to ensure that we do not put the health and safety of the Bahamian people at risk. Certainly there's the validation component, but there is also the quality assurance component. And we have asked Drs. Indira Martin as well as Dr. Edwards to work closely on putting in place a system that will allow us to actually be able to ensure that we have the continuous quality assurance component and the biosafety mechanisms in place at all institutions or that are approved and validated to actually carry out these rapid tests. Now, the lab personnel will need to continue to give the guidance on what those things will be. Monitoring of it will be something that we have to, enhance our inspectorate capacities for. We have inspectors that go into various facilities, but I think that the general public needs to be aware of, what is acceptable and not acceptable. We anticipate putting out a number of communication. We're working with our communications grouping to ensure that we put out the list of laboratories as well as the list of tests that would have been validated by the National Reference Lab, or in order for the public to know what is acceptable and not acceptable. We know that this has started to take on a life of its own, but we anticipate putting those standards around what is happening and enhancing our monitoring to ensure that these tests are not occurring in an indiscriminate way. When you speak of the large hotels, though, we know that they generally have in place health and safety officers, and many of them actually have healthcare providers on staff. So we work closely with them on other public health matters. So we will also use that avenue to ensure that we are not allowing these tests to be done indiscriminately. I didn't know if any of the lab personnel wish to add. If not, do you have a second question?
Yes, thank you so much, Dr. McMillan, for that answer. I think that clarifies a lot of some of the concern out there with respect to these rapid antigen tests. My second question is respective to the transition from Samaritan's Purse at the Princess Margaret Hospital. I don't know if the minister wishes to answer, or yourself. How is that transition going to take place? I understand that they're leaving, well, he would have noted that they're leaving this weekend. They've already turned over equipment and the tents and everything else. How are we going to ensure that the job that they have been doing with assisting us continues?
I allow Ms. Walker, who is now PMH, to come. I would like to say, certainly we've had great experiences with Samaritan's Purse in the past. They would have worked with us during Dorian, and certainly we are confident that the processes that they put in place are world class. Ms. Walker will give you a little more information with respect to that.
Good afternoon. Thank you for your question. Indeed, Samaritan's Purse has been a lifeline for our healthcare workers. It allowed some of our persons who have been working from March to get some relief while they helped us to take care of our own countrymen. The handover process is fairly smooth and would have started yesterday, but I would preeminently say that it actually started when they came to set up, because our teams worked very well with them in the setup, as well as working with them and being taught by them, enhanced training with IPC measures throughout the whole process of them being with us and helping us here at Princess Margaret Hospital. Not only were the doctors and nurses working with them, were also with their technical teams, with the tents and all of the equipment that they brought here with us. All of that has been done in a very seamless manner, so that we anticipate that our team can continue. As the minister would have indicated, the handover would have started, and in fact, today it was Princess Margaret Hospital's team that was in the Samaritan's Purse facility rendering care, and we anticipate that we will continue to have that experience. Thank you.
Thank you, Ms. Walker. Karen Bain.
Good afternoon, Minister Wells. Good afternoon, CMO and the Ministry of Health team. Good afternoon, Bahamas. Karen Ferguson Bain, Global 99.5 FM. With the start of the twindemic, as stated by Minister Wells, we are urged to take the flu shot as a defensive measure during the flu season, coupled with the potential surge of COVID-19. Is the Ministry of Health planning to visit schools throughout the Bahamas to give the flu shots to school-age students and teachers as a preventive measure to reduce the number of students and teachers contracting the illness?
Okay, certainly the outreach efforts of the expanded program on immunization have started, but as you may be aware, certainly in this COVID period, we have had some, I would say, challenges with respect to actually reaching all, but Dr. Swan works closely with education, and he will be able to give you some insight into some of the measures that we have taken in order to ensure that the target populations are actually reached.
Thank you for your question. Yes, so the Ministry of Health's expanded program on immunization, the EPI program, is a program that has been working for the last, I could say, 2 months, preparing for this, I guess, this flu season coming in. And we've had, as Dr. McMillan mentioned, some challenges in implementing our plan. That being said, we are still open and we're still doing visits to large workplaces where we're able to give them vaccines on the job site. Schools, for the most part, in New Providence, as you may know, are closed, but we do have the opportunity for those schools that are interested to reach out to the EPI program, and we'll make arrangements to come to the schools and give vaccines. We have also expanded our hours at the clinic for vaccinations so that persons can get access to the vaccine. So as much as is practicable during these times of restricted movements and restricted gatherings, we're trying to tap into the resources that are available to ensure that the vaccines are as accessible and available to as many persons that would like them. And again, you just call out to the EPI unit and we'll be able to make arrangements to come to your work site if you have sizable numbers to offer the vaccine. And as soon as restrictions become a little less, we will have sites of vaccinations or points of vaccinations at some parks and supermarket parking lots in the communities to ensure that the vaccine is accessible and available. It's in country and it's ready to be given. You have a team of persons who are willing and able to give the vaccine, and as soon as conditions allow, we'll be able to expand the offerings of the vaccine. So thank you very much for your question.
Second question, Mrs. Ferguson Bain.
Yes, ma'am. Thank you, sir, for your answer. Thank you very much. A hurricane alert has been issued for Andros, the Northwest Bahamas, and New Providence. What are the Ministry of Health's plan to relocate the COVID-19 isolated patients being cared for in the Samaritan Purse tent should conditions worsen for New Providence?
Okay, Mrs. Walker.
Good afternoon. Thank you once again. Indeed, we are closely watching and monitoring the media as well as everyone else with respect to the weather and how it may affect us this weekend. The engineering team, as I indicated, would have had a handover from Samaritan's Purse, and so they are prepared and ready and able to deflate those tents if necessary. We will then have to make sure that we evacuate the persons who are in there as well as the equipment. We would have gone through a similar exercise, as you can appreciate, in Grand Bahama from time to time, as we were using the same technology in those tents in Grand Bahama. So likewise, our staff have been trained to do just that. And we will make sure that we ensure the safety of the patients as well as the staff and equipment. Thank you.
Shamarko Lightborn.
Hi, good afternoon, Dr. McMillan.
Good afternoon.
I'm Samarko Lightborn from the Blaze 98.3 FM. And my first question, there's been a trend of key hopping from mainlands that have surrounding keys. A lot of reports indicate that these are recreational, beach parties, for instance. What would be the contingency plan for those small keys who may have, say, 200 to 400 persons if there is a mass outbreak, knowing the limitations of the healthcare facilities and traveling capabilities on those locations?
Okay, certainly we, in the Bahamas, we have over many years had to ensure that our healthcare system is robust enough to manage cases of many illnesses on many keys, many islands. So we have a fairly connected network of healthcare facilities. Dr. Bartlett has oversight for Family Island at this point. I'll ask her to give an example of how we interact with the keys.
Yes, good afternoon again, Bahamas. So as you know, all of the keys come under our main area clinic in Georgetown. So that is Black Point, Farmers Key, and Staniel Key. If an event should happen in any of the keys and we have to send in reinforcement, we will send in reinforcement staff from the mainland, Georgetown, Exuma, which will include medical professionals, doctors, nurses, and allied health if needed to go in and deal with the situation. And so that we can triage, prioritize, and get the ones out that need an additional support that being transferred to from the Family Island or the Keys into Nassau for that other level of tertiary care. So we would then, the ones that are not so ill, triage them on the ground and give the appropriate treatment as possible. So we do have support services in place from the main Georgetown to support the Keys. And if it comes to that, even from Nassau, if needed, to be able to support the event that is happening there in any of the Keys in Exuma. Thank you.
Mr. Lightborn?
Thank you. And secondly, yesterday, an organization called the Caribbean Public Health Agency had a virtual launch of what's known as the Caribbean Travelers Health Mobile App, which is essentially a health information repository, and it's designed for travelers to get info about COVID data, travel requirements, accommodation listings, and even where they can get info as it pertains to getting approved COVID-19 tests. As we advance in welcoming visitors, is this a partnership that the Ministry of Health is a part of or contributing to your knowledge? Because it does seem very forward-thinking. And if so, have we been considering maybe creating an application of our own that does something similar?
Okay, so the simple answer is yes. We work very closely with the Caribbean Public Health Agency. Certainly, a number of us would have been on that Zoom that you spoke about, but we have been considering utilizing that app, and as we move forward, as we move forward in our opening and need for continuous monitoring, that is a high on our list of considerations for what could be utilized. Additionally, we already work closely with the Caribbean Public Health Agency as it relates to the tourism and health program. So we already have a monitoring system for public health concerns in place. That app kind of links into that. So we already have the rudimentary pieces in country that is required. And our tourism partners, we have worked closely with them as it relates to ensuring that they become aware of the system. And we've had many sessions. So long and short, that is something that we are actively considering. And should it be a requirement that we, I guess, modify it, or we may be able to utilize it in the state that it is now, but we will continue to work with CARFO and our tourism partners to ensure that the necessary monitoring software is actually put in place to, as best we can, keep our population safe while we invite our visitors to the country. Next question. Oh no, that was your second. Rashad Roll.
Good day. Just to go back a bit to the question that Sasha asked, Mr. Wells mentioned the 4 requirements that must be followed with respect to use of the antigen tests. Are officials actively investigating any instances of the criteria not being followed? There've certainly been some unconfirmed reports about unauthorized use of the test in Eleuthera. And I'm wondering if you can give any insights into whether that's the case.
Certainly the team that was on the ground in Eleuthera brought some concerns to our attention. And we are actively seeking to investigate exactly what is happening on that island. As it relates to the protocol that the minister would have alluded to, we would have had capable and competent lab personnel actually work on putting together that protocol, and that has been approved at the national level by the EOC, and certainly that is something that we would be in a position to provide wider. And as we move forward with the validation and the verification and quality assurance measures that were mentioned earlier, all of those pieces will come together for us to be able to ensure that those, as you would have alluded to, unconfirmed instances diminish and actually, ideally, not occur. So long and short, we are becoming aware of those situations, and we are enhancing our capacities to be able to ensure that those situations are actually dealt with in a proper manner.
Okay. And given that the antigen test is only useful for symptomatic people, how secure should we feel about the 5-day results for travelers and what it says about whether they have COVID-19 or not?
Certainly, I have Dr. Edwards here who can speak to the specifics of the use of the antigen test, as she would have assisted with putting the protocol together. And we intend to utilize the antigen test as per the recommendations, and our protocol would speak to the specifics of how we intend to utilize it now. So Dr. Edwards is not prepared to speak to the specifics, but what I would say is this. The protocol does speak to utilizing the test in symptomatic persons. In our collaborations with tourism, we would have shared our protocol. So we anticipate that the protocol will be utilized as per the recommendations in the national protocol. Once it is utilized in that way, then we can feel very secured in what the results are. So the reason why we have protocols that are based on international guidelines is to provide that security. So long and short, the protocol that we would have agreed upon in the national EOC speaks to use of the antigen test in certain circumstances. And we anticipate that tourism, as we move forward, will be actually using it in that way. Thank you. Tyler Simonet.
Hi, good afternoon to health officials and to all who are listening. Actually, we can't hear you. I think that your mic is muted. And we missed the last answer to the last question, so I think maybe you could unmute the mic and then repeat your answer because the last reporter's question wasn't answered.
Okay, can you hear us now?
I think we can hear you now.
Okay.
CM.
Okay.
Okay, yes, we can.
So, are you referring to the last question regarding how secure we feel as it relates to the use of the antigen test? I'm not sure.
Well, I was just referring it to the last reporter. Maybe you can unmute the last reporter and he can repeat the question because it wasn't my question. It's just that we couldn't hear you.
Okay. Well, I think what we would do is go ahead with your questions, and then we will see how we can potentially assist in that way. Do you have a question?
Yes, I do. The BBC, also good afternoon to everybody who are listening. The BBC recently released an article that Danish authorities have said a lockdown will be introduced in some areas due to a coronavirus mutation found in minks that can spread to humans. The article also noted that the Danish government warned that the effectiveness of any future vaccine could be affected by the mutation. Have health officials heard about this, and could you help shed light on, how this is even possible, and should this be a concern for us at this point in time?
Not. I guess I've not seen or heard the article that you are referring to, but I know for a fact that viruses can mutate, and certainly, vaccinations can be, when we have like the H1N1, the flu vaccine, every year we get a new flu vaccine, in part because of the number of strains that we have to actually be contend with. The COVID-19 SARS-CoV-2 virus, I anticipate, has the same potential. I will ask, I guess, either Dr. Brennan or Dr. Forbes to elaborate on if they are aware of the article, and they could speak to, what their thoughts are. Dr. Forbes, you want to start?
Good afternoon. Yes, I'm aware of the article. And so scientists are aware that when you have mammals in close proximity, especially with humans, there can be species jumps and mutations of viruses. And so, as you correctly said, the Danish government is culling those minks because they are found to have COVID and can transmit them, and were transmitting them to humans. Experts are looking at that strain to see what will be conferred because of that. But these are some of the challenges when you have emerging viruses and how they can mutate. And yes, you're right, it can impact vaccinology and strains that are covered in the vaccine. All the more reason for us to continue to follow the preventive measures.
Thank you, Dr. Forbes. Do you have a second question?
Yes, I do. Thank you so much for that response, Dr. Forbes and CMO. My second question is, could health officials explain the rationale between allowing persons to enter food stores and pick out what items they need versus hardware stores specifically, such as Kelly's and AID, just to name a few, those stores only being allowed to use curbside service? Some of these hardware stores are as large, or if not larger, than some food stores. So if health officials could just shed some light as to why they're restricted to curbside service.
Okay, certainly. The principle behind, the spread of and transmission of the virus will remain the same. It's about how the virus spreads when you're in close contact. As it relates to some of the measures in place, I will not speak to any of those, but we will continue to make the recommendations based on how the virus spreads. Certainly in food stores, you still have to keep your distance. You still need to wear your mask. As it relates to other institutions, I think should the curbside restrictions be removed, we have to, make, I think, extra effort to ensure that we keep a mask on, because the more places that we have opened and allowed to have, free movement, that increases the likelihood of additional contact, and we would wish to diminish the likelihood of spread of the virus. Now, specific to which businesses, and I will not, Minister, would you wish to add to any? No? Okay. So, next, no. I think that was your second question. Royston Jones?
Good afternoon. This is a follow-up question from an earlier question from Rachel. I understand the Deputy Chief Medical Officer said that the data or report of the exact number of follow-up tests may not be available at this press conference. It may come at a future press conference, but I think it would be helpful to get confirmation on whether or not testing has been performed, follow-up testing has been performed as of today from visitors or arrivals from November 1st, just for confirmation as to whether the testing has been conducted.
I believe Dr. Brennan would have suggested that that data, he doesn't have the data right now. I can give him the opportunity to speak again.
Not necessarily on the data or the numbers exactly, but just has it been performed today?
Dr. Brennan?
Good afternoon. Yes, ma'am. So thanks for the question, Mr. Jones. So we can confirm that testing at those locations has commenced and that people are taking advantage of those locations to be able to do their testing. And again, if persons who may not have heard earlier, if you are looking for the list of testing sites where you may need to be tested because of travel-related activities, or you need to inform someone else as to where it is, you can go to the travel.gov.bs website, or you can go to the Bahamas.com websites.
Thank you, Dr. Brennan. You have a second question, Mr. Jones?
Thank you for the response, Dr. Brennan. Appreciate it. My second question is also related to the follow-up testing, and perhaps the minister can shed some light on this. But is it the intention of the Ministry of Health to separate the follow-up testing data on the COVID-19 dashboard, to separate it from the overall testing and give a separate account for it? So there's greater transparency and accountability of the testing regime concerning follow-ups. For example, we can be able to look at arrivals in a certain period and have a reconciled number of tests, of follow-up tests, to be able to get greater accountability. Is that the intention? And Minister, could you also, if you allow me, speak to the 100 nurses from abroad we were looking at engaging?
Minister?
Well, I'll begin where you ended. The reality is that we, the Nursing Council of the Bahamas, would have just conducted a test for, I believe, some 71 nursing students who would have completed their training. They're actually working inside the medical health environment. And upon us obtaining those results, we'd be looking to employ them as full-time nursing officers. We are still in the process of seeking to source nurses from abroad. Even before COVID, there was a study done by both PMH and the Ministry of Health that basically showed that the country is lacking well over 300 nurses, and that was before COVID. So we'll be looking as to how we can assist in procuring some of those nurses from abroad, but we will only do so after we would have employed all of the Bahamians who would have rightly qualified themselves to be in the industry.
I think that's it. Okay, I believe that ends our list of questions. So thank you, Bahamas, for joining us, and have a great afternoon and a wonderful weekend.